Most people with an L4-5 disc bulge think they're doing everything right. They try physical therapy exercises, injections, medication, and everything else that is recommended. Yet, they still wake up with the same sharp leg pain and growing fear that surgery might be the only option left. Now, the truth is that the reason the pain keeps returning often has nothing to do with their effort and everything to do with how their disc injury is being treated. Now, this becomes clear when you hear Michael's story. When Michael first came into our clinic, he was a 55-year-old, but he moved like someone much older. He walked in stiff, guarded, and exhausted, and his L4-5 disc herniation sent sharp electric pain down his right leg. He could not sit for more than 10 minutes, and he had to stand during work meetings. He slept in short intervals because just turning in bed caused sudden bursts of pain, and his body language showed how much he was struggling. Michael had already done what most patients try before they find us. He completed 8 weeks of physical therapy, which made him feel loose during the sessions, but never gave him lasting relief. He tried anti-inflammatory medications and muscle relaxers, which upset his stomach and did little to reduce his symptoms. He went through 2 epidural steroid injections that helped for a few weeks and then stopped working. He even had a surgical consultation where he was told he was not a surgical candidate yet and to simply monitor the condition, even though he worried it might get worse. Now, what affected him the most was that the pain limited his life. He stopped driving long distances because the discomfort became unbearable. He stopped lifting and playing with his grandchildren. His wife told him he moved like someone twice his age, and he felt restricted and embarrassed, and even feared losing the active lifestyle he once had. Before beginning any treatment, we sat down with him and conducted a complete consultation. We reviewed his medical history in detail, but more importantly, we asked him how this problem was affecting the parts of his life that mattered most to him. Now, we talked about what he could no longer do, why that mattered, and what he wanted for his life once he recovered. You know, many patients have never been asked what getting better truly means to them. Now, next, we performed a comprehensive examination that included orthopedic testing, neurological testing, postural and joint analysis, and a careful review of his MRI findings. Now, we explained what these findings meant and why his symptoms were recurring and how his disc injury was influencing both his present condition and his future if not treated correctly. From there, we built a treatment plan specifically for Michael's disc injury. His care included non-surgical spinal decompression focused on the L4-5 level, class 4 laser therapy to support healing, stabilization exercises designed to reduce recurrence, and lifestyle adjustments along with home exercise routines that allowed him to continue improving between visits. Now, his progress began quickly. By week 2, the numbness in his legs started to decrease. By week 4, he was able to drive again without needing to have frequent breaks. And by week 6, his leg pain dropped from a 9 out of 10 to a 2 out of 10. And by week 8, he completed full workouts without pain. Now, the moment that mattered most to him happened outside of the clinic. He was able to take his grandchildren to the zoo and walked for 5 hours without pain. He told us he cried on the drive home because he believed he would never experience a day like that again. Now, this is the type of recovery that becomes possible when the underlying disc injury is identified accurately and treated with a methodical, individualized approach. Now, by watching this video today, you will understand why your back and leg pain keeps returning, what actually needs to happen for an L4-5 disc bulge to heal, and the proven step-by-step process that has helped patients regain mobility, eliminate leg pain, and return to the life they have been missing. Now, you will also hear 2 additional patient success stories that show exactly how these results happen in real life. Stay tuned. I'm Dr. Tam Ly. I'm a chiropractor here in San Jose, California, with more than 20 years of experience helping people with disc injuries, back pain, and sciatica who have tried everything and still live with pain. I created this channel to give people real, non-surgical, science-based solutions that actually address the root cause instead of just masking symptoms. Now, if you want to protect your spine, understand your condition, and learn the treatments that help people get long-term relief, subscribe to my channel. I post a new video every week. An L4-5 disc bulge or herniation is not just a sore back. It is a structural change in the disc that creates mechanical pressure and inflammation in the lower spine. Now, when the disc pushes outward, even slightly, it will irritate the nearby nerve and the roots, and that irritation creates the burning, the pulling, or the electric pain that shoots into the leg. Now, some people feel it is a kind of like a numbness or tingling. Others may describe it as a deep ache that never lets go. The tricky part is that the pain can calm down for a day, a week, or even a month, and then flare right back up with one wrong movement or a long day of sitting. Now, this happens because the underlying disc pressure is still there. Medications may dull it, therapy may loosen the muscles around, and injections may just quiet the inflammation temporarily. But none of those treatments actually change the mechanics of the disc or the irritation on the nerve. This is why so many people find themselves stuck in a cycle of temporary improvements and sudden setbacks. The disc never truly resets, and the nerve never gets the space it needs to calm down. Until those two things happen, the pain continues to return, and daily life becomes a balancing act between what you can do and what you fear will trigger another flare. To create the conditions necessary for healing, we guide each patient through a structured program built around precision and clarity. We begin with a detailed consultation to understand the medical history and the ways the pain is limiting daily life, work, family roles, and long-term goals. This helps us establish what successful recovery looks like for that individual. Now, after that, we will perform a comprehensive examination that includes orthopedic, neurological testing, postural and joint analysis, and a review of x-rays or MRIs. Now, this allows us to identify the exact cause of the symptom and determine the safest, most effective treatment path. With those findings, we design a personalized treatment plan. This may include non-surgical spinal decompression to help reduce disc pressure, class 4 laser therapy to accelerate healing, or shockwave therapy to reduce chronic muscle guarding. Stabilization exercises can help improve core control and protect the injured disc. Nutritional supplementation and chiropractic adjustments are also added when appropriate to support the recovery. Throughout care, we reassess your progress and adjust the plan as the patient improves. Some people, they recover with a shorter series of visits, while others may, with more advanced or long-standing disc injuries, require a longer program. Now, once someone reaches a stable point with minimal or no pain, we transition them into maintenance care and provide a structured home program to help protect their results long term. Now, this systemic approach consistently helps patients return to movement, confidence, and activities they feel they had lost. Now, Rebecca is one of the patients that we see here in the office, and her story shows how powerful the right plan can be. Rebecca came to us at a point where she felt her identity was slipping away. She's the type of person who holds everything together at home, at work, and for her teenagers. When her L4-5 disc herniation, began, it was causing her burning, sciatica into her right leg, and it did more than just create pain. It disrupted the entire structure of her life. Now, she walked into the clinic leaning slightly to the left, trying to take pressure off the nerve, sitting for more than 15 to 20 minutes, calm burning down her leg. Her back felt weak, almost as if it could give out at any moment, and she could not sleep comfortably on her right side. She looked tired, frustrated, and worn down by the effort it took just to get through a normal day. Now, by the time she found us, she had tried several things. She completed 6 weeks of physical therapy, which made her feel good during the sessions, but did not change her symptoms. Massage and stretching classes gave her temporary relief, but nothing lasted long. NSAIDs and muscle relaxants left her foggy and dealing with stomach discomfort. She also tried an epidural injection that helped for 10 days before the pain just simply returned and stronger. She had been told that surgery could be her next step if things did not improve. Now, the emotional impact was significant. She could not sit through her HR meetings without standing awkwardly. She stopped attending her kids' sports games because the bleachers made her leg burn more. And she had to cancel her morning workouts, mainly because, it just caused her that much more pain. And unfortunately, that was her main outlet for stress. Now, even her team at work noticed she was quieter and less focused. She told us she felt like she was, failing in every area of her life, saying, I'm supposed to be the one who supports everyone else, and I can barely support myself. We created a treatment plan focused on decompressing the disc, calming the nerve, and restoring the stability she needed to feel strong and capable again. Non-surgical spinal decompression was targeted directly at the L4-5 segment, giving the nerve space so that it could calm you down. Shockwave therapy helped release chronic stiffness and muscle guarding, and she learned nerve gliding movements and stabilization exercises to protect her spine. Now, we reviewed her workstation setup and sitting habits and gave her strategies she could use immediately at work. Nutritional supplementation supported her joint health and helped reduce the inflammation. Within 2 weeks, her leg pain began to fade and she could sit closer to 30 minutes without burning. By week 4, she returned to watching her kids' weekend sports events without standing the entire time. And at week 6, she restarted modified morning workouts and reported a 70 to 80% improvement. And by week 8, she completed a full HR training day, 6 hours of workshops without pain. And at week 10, she ran a staff meeting from start to finish without shifting or standing, something she had never been able to do. Now, the most meaningful part of her recovery was the sense of self she regained. She told us, I feel like I got me back. Her patience returned, her confidence returned, her energy returned, and even her coworkers commented that she looked like herself again. Now, Rebecca's transformation showed what is possible when the disc is treated correctly and the patient is supported with a plan that matches their life. And for patients with more severe disc injuries, the results can be just as powerful. Gary is one of those examples, and his story is a reminder of how life-changing the right approach can be. Gary came to us in a state of frustration and genuine worry. As a retired fire captain, he spent his entire life staying active, strong, and ready for anything. Now, with a severe L4-5 disc extrusion sending stabbing pain down his left leg, he felt like his retirement was slipping away before it even began. Now, he described the sensation like someone plugged a live wire into his butt and ran it down to his ankle. Even standing still was difficult. He leaned heavily to his right side just to avoid the pressure on the nerve, and he could not walk more than 50 yards without stopping. He had already tried several treatments before reaching our clinic. 6 weeks of physical therapy helped him feel stronger, but the nerve pain remained untouched. He cycled through medications, including gabapentin, NSAIDs, and muscle relaxers, but he felt foggy and uncomfortable with a little relief. Now, a cortisone epidural provided no improvement, which genuinely really alarmed him. A surgical consultation ended up with a recommendation for early microdiscectomy, Well, he wanted to avoid surgery unless there was no other path forward. Now, the physical limitations were difficult, but the emotional ones carried even more weight. Gary loved to golf, traveling with his wife, and staying healthy as he entered what he called his golden years. He already missed multiple Saturdays with his golf group, and he had to cancel a retirement trip to Hawaii because sitting through a long flight felt impossible. Now, the moment that hit him hardest was not being able to lift his grandson comfortably. He told us, almost tearing up, "I waited my entire life to retire healthy, and now I'm watching my retirement disappear." We developed a plan specifically designed for severe disc excrusions like this. Non-surgical spinal decompression was the cornerstone, helping him relieve the pressure on his disc and the compressed nerve. Shockwave therapy targeted the deep trigger points and the chronic muscle guarding that he had felt. We also taught him disc unloading positions and movement patterns that helped to minimize nerve irritation throughout the day. As his symptoms began to settle, we introduced controlled core stabilization to protect the injured area and support long-term improvement. Now, the changes started gradually but consistently. By week 2, he noticed the first meaningful shift, less electrical pain running down his leg. By week 4, he could stand in his backyard for about 20 minutes without leaning on anything. And at week 6, his pain dropped from a 9 out of 10 to a 2 or 3, and he began walking for longer stretches. And by week 8, he returned to the driving range and gently hit 30 balls without pain. And by week 10, he played his first full round of golf in whites. But the moment that meant the most to him came shortly after. He told us, "I played 18 holes on Saturday, then spent Sunday on the floor building Legos with my grandson and living again." His wife said he was smiling more, moving more, and participating in life again. For Gary, the goal was never just to get the pain to go away. It was to getting his retirement back, and he did. When you look back at Michael, Rebecca, and Gary, their stories may seem different, but they share one important theme. Each of them tried multiple treatments. Each of them worked hard to get better, and each of them still found themselves stuck because the one thing they truly needed was missing. Their discs were never fully decompressed, and their nerves were never given the space to heal. Now, once that changed, everything else began to fall into place. Now, the truth is, many people with an L4-5 disc bulge or herniations, they go years without ever experiencing proper non-surgical spine decompression. They stretch, they strengthen, they medicate, they rest, and they push through. But the underlying mechanics of the disc never change. Now, when decompression is finally added, the results can feel life-changing, just as you saw in these 3 cases. Now, if you are dealing with the same kind of pain and limitations, there is real hope. Look for a qualified spinal decompression doctor in your area, someone who understands how to treat disc injuries with a structured, evidence-based approach. And if you are in the San Jose area, and we would be honored to help you. This is what we do every day. If you need help finding a reputable decompression provider near you, leave a comment and let me know. I will do my best to point you in the right direction. Now, you deserve the chance to get your mobility, your confidence, and your life back. The next video you should watch is the one where I guide you through 10 easy to do exercises for an L4-5, L5S1 disc bulge recovery, including 5 exercises that strengthen your spine and 5 that gently decompress your spine. Go watch that video next.